Good morning, everybody. Welcome to today's 1 million by 1 million strategy roundtable for entrepreneurs. This is a very special event, and I welcome all of you to our 400th roundtable. As you know, 1 million by 1 million's mission is to help 1 million entrepreneurs reach $1 million and beyond in annual revenue, build $1 trillion in global GDP and 10 million jobs. And in support of that mission, we've been doing these roundtables year after year, week after week, and it's been an incredible journey working with so many of you in so many different parts of the world. And it's a real thrill for us to get here with you. And, just to give you a little bit of numbers, we are today, 1 million by 1 million today is touching a community of over 500,000 people. Over 75,000 people have attended these roundtables, and it really, literally is global. And not only, if you go through Google and do a search on the startup hubs, you'll get a list of cities. We are seeing, obviously, people from all of those cities, but we are seeing people coming here from way beyond that. And that was part of the whole idea of creating something virtual and scalable and accessible from anywhere in the world. So when somebody shows up here and says, I'm doing a security startup company in Cape Town, or I'm doing an online milk delivery service in Srinagar, Kashmir, in the foothills of the Himalayas, it thrills me to bits. And these are real stories that I'm talking about, and it's been fascinating to hear about all these ideas and all this entrepreneurial energy bubbling everywhere in the world. So as usual, the session is being recorded. That session, that recording is going to be available on our YouTube channel, 1M1M Roundtables. And there you will find recordings of every single prior session. It's an incredible learning material. So I encourage you to listen to more sessions as part of your journey. If you're live tweeting the show today, please use hashtag 1M1M. And on Twitter, we're at 1M1M and at Romana. This is a roundtable. We will get to your questions and your thoughts and your insights in a bit. We're going to start with some programming. So normally, as you know, if you're following this series, our format is we have a guest in the beginning for about half an hour, and then we do entrepreneur pitches from all over the world, and we do basically working sessions. So today's is a slightly different format just because it is not our usual roundtable. It is a milestone session. We've invited some superb entrepreneurs to teach you what they have learned in their entrepreneurial journeys. And as you know, the whole program is case study based. So those of you who are following the blog or those of you who are following the curriculum, you're all learning from case studies. You're learning from people who have done it before. So you're learning from people's hands-on experience, their lessons from the trenches. So in that spirit, we've invited 4 entrepreneurs today, and I will introduce them as we go along. 3 of them are entrepreneurs who have been part of the 1 million by 1 million program, and one of them is a 1 million by 1 million case study. So, I will introduce first, actually, Vikrant Mathur is going to speak with you, and then we have Heidi Jannenga, then we have Avik Pal, and then finally Abhishek Rungta. So these are the 4 entrepreneurs you're going to be hearing from. They're in different parts of the world. So we are going to start with Vikrant, and you will see as soon as Vikrant comes on the camera that he is dialing in from his car. So this is the extent of scalability and flexibility we have here. You can dial in from your car, you can dial in from your flight, you can dial in from your home in pajamas, whatever you want. So that is really the great fun in the program. Vikrant, over to you. Take it away.
Thank you, Shramana. Good morning, everybody. It's so exciting to be here for this roundtable. Before we get started, I just kind of quickly share a little bit of my experience with 1Mby1M. I was talking to my wife yesterday, and I was telling her that I remember joining the program about 10 years ago, and I distinctly remember what drew me to the program. It was, Shramana, your focus and your support for bootstrapping, especially here in the Valley. And I had just moved here, and I was talking to all these people, and the focus was so much on raising money and chasing venture capital that when I came across the 1M1M program, it was just so refreshing to me that you were talking about building a product and testing it with customers and generating revenue before taking it to the VCs to help scale up. So, before we got started, I just wanted to thank you for all of your help, support, guidance, mentorship, and congratulations on all the success with the program. It's just amazing, and it's great to be a part of this community.
So thank you, Vikrant. I would absolutely reinforce that point. Bootstrapping has been the mantra of the program, and where we have raised money for our entrepreneurs, it's always been bootstrap first, raise money later. So it's a absolute core philosophy of the 1M1M program, and you should never feel pressured to raise money. And I'm really against all these incubators and accelerators who are force-feeding capital to people and forcing you to go after financing when you're not ready yet. So absolutely, completely echo Vikrant's thoughts there. Go ahead.
Great. Next slide, please. So by means of introduction, my name is Vikrant Mathur. I'm the co-founder of Future Today. Future Today is a video distribution platform that enables content creators, both big and small, to distribute, promote, and monetize their content, specifically on connected TV platforms. So platforms such as Roku, Apple TV, Amazon Fire TV. We started the company in 2006, and so it's been about 12 years, and just saying that is making me feel old. But it's been an amazing ride. We, over the years, have now gone to a point where we're working with 500+ content partners, managing 1,000+ apps or channels, as they're called, across a variety of different devices, across a variety of different content categories. We have 50+ employees now across 3 locations, and very similar to this program, actually, the vast majority of our workforce works virtually. So it's been really, really helpful for us to scale up and find the right talent, irrespective of the location that they're in. We're cash flow positive. We are profitable. I think, with the exception of maybe 1 year, we've always been cash flow positive and profitable, and that's primarily because we haven't raised any money. So we had to really focus on revenue and profitability, because without that, we couldn't sustain ourselves. We did try to raise some money early on in 2007, 2008. We came pretty close, but it did not happen, primarily because the firm that we were talking to, they didn't quite believe in us. We did not have the experience in the media industry that would give us the credibility to kind of pull it off. And I think it was a blessing in disguise, because had it happened, we would have been shut down, I think, 3 times over. So we're still bootstrapped. We've funded the company through our own savings primarily, and now don't have to invest anymore, because the profits that are coming from the company are being reinvested back. This slide, I put it together because I wanted to give you a little bit of history and perspective on how we got started and kind of the journey that we've been through. So like I said, we started in 2006, 2007. The original idea was to essentially put together a video-based service for food and cooking-related content. And this is, again, back in 2006, when YouTube hadn't been acquired by Google. Nobody really knew or understood what video online was going to be. And we just felt that more and more media was going to be consumed online or be streamed. And so we thought that it made sense for, at least in the food and cooking space, which we kind of stumbled upon, for there to be a service where it's 6 in the evening, you want to make something. If you're anything like me, you have no idea how to make even meatballs and pasta. And so you could either go to Google, search for recipes, or you could come to our service where we could give you personalized content based on your taste preferences, based on your health-based needs, and a variety of other factors that we would consider. So that's how we got started. And again, just given how early we were in the online video space, we were able to, with not a lot of capital, with not a lot of PR and marketing, be able to scale up because people would find us. And because we were very, very unique in what we were doing, they would come back to the site and continue to watch and consume content. So by 2010, we had become one of the top 10 global food websites with over 10 million unique visitors. And again, this is 2010 when 10 million actually was significant. Now, if you talk to Facebook and Snapchat and all of these guys, 10 million is a drop in the bucket. But in the process of growing and scaling iFood, we had put together a technology platform that could ingest any piece of content and put it up on web, mobile, or connected TV devices. So we were able to essentially distribute content through the infrastructure that we had put together on all of these different devices. And then as iOS and Android were kind of gaining scale, we decided to launch on mobile platforms, and then eventually also in 2010, launched on connected TV platforms, Roku, Boxy, Yahoo Connected TV, the original Google TV that was there. Again, in the connected TV space, we were really, really early to market, and nobody quite understood what that space was going to look like, but we just thought that more and more media was going to be consumed through streaming on big screen televisions, and so we had decided to kind of expand into that space as well. Everything was going great, but then in 2011, Google started to make changes to their algorithm. So one of the problems that we had, which we didn't really think back then was a problem, but looking back now, we realized was a big, big risk, was a vast majority of our viewership and traffic was coming through Google search. So it was people going to search, typing in cold pasta chicken salad recipes, and then coming to our site as one of the recommendations or one of the search results that were provided back to them. And what happened was, as Google better integrated YouTube, and as they always do, they continued to change their algorithms, we started to lose traffic. So as a result of that, over a period of, I would say, 6 to 9 months, we lost about 80 to 90% of our traffic. And we were struggling. We didn't really know what to do. We didn't know how to react. We were trying to kind of chase the algorithm every time they made a change. And towards the end of it, we realized that it was a pointless exercise because it couldn't be done. So we looked at where the industry was going, and this is, again, when Netflix was starting to move away from the DVD business into streaming, and we just felt that we had put together a platform and infrastructure that could be used for distribution on connected TVs. We felt that that was going to be the future, and so even though it was still very, very early in the industry and in that space, we decided to focus on connected TVs. We decided to abandon the desktop and, or at least heavily scale back the desktop and mobile side of our business, and just focus on connected TVs and start to build scale there, because the engagement that we were seeing on those devices much, much higher than what we were seeing on desktop and mobile. So as we expanded onto connected TVs, we decided to expand outside of food into other categories, because again, the audience on these devices was so small that we couldn't just sustain ourselves by operating within the food category. And so kids and family was the first vertical that we expanded into after food, and then into other lifestyle verticals. And fast forward to today, we have, I think, 1,000 channels, like I said, that we're managing in about 10 or 12 different categories. Movies and TV, kids and family, and lifestyle are the top 3 categories. But essentially by making that change and kind of, I won't say pivoting, but focusing more on the technology and the distribution side of the business as opposed to the media side of the business has helped us very, very quickly scale our viewership and the offering that we have to the consumers. Next slide, please. So in terms of lessons learned, and I think, I just got so excited about the roundtable that I've gone overboard a little bit in terms of the number of slides that I have. So I have about, I think, 10 or 12 slides here. And I'll try to run through them quickly in the interest of time. And happy to connect with anybody that wants to discuss more about any of these points that I'm making. But the first thing that I wanted to kind of highlight was, in the Valley here, there's a sentiment that any startup that you work on needs to be a billion-dollar idea. And I can kind of understand, the VC perspective as to why they would want to invest only in companies that are billion-dollar ideas. But what I'm here to tell you is it's okay to have a 10 million, 20 million, 30, 50 million revenue company, especially if you're bootstrapping it for the most part and you're not going to be raising external capital to the tunes of tens or hundreds of millions of dollars. So it's okay to go after an idea that you really care about, that you're passionate about, even if you think that that's not a billion-dollar idea. The only thing that you have to keep in mind is to make sure that you manage your costs accordingly and not raise so much money that you raise expectations or dilute too much. The second thing that we found out as we were kind of doing this was ideas are a dime a dozen. Right? Everybody has many, many ideas. So at the end of the day, it's all about execution. Right? Google was not the first search engine. Facebook was not the first social network. But it's all about how you execute on your idea. That's really going to define what success looks like for you. Right? Don't worry about people. I hear of companies that are in stealth mode for 5 years, 7 years. And I just, to me, it's crazy. I think you should share your ideas. You should not worry about people copying your ideas, bounce your ideas off of people, get feedback, use it to improve the product, use it to improve on execution. So don't be scared of sharing ideas. Next slide, please. The third thing is, as a bootstrap startup, we had this problem where we couldn't always hire superstars. We wanted to hire a bunch of really, really smart developers, as an example, but we didn't have the ability to pay them. And so, so reach out to your extended friends and family, network, hang out at conferences, meet people that care about the same problem that you're trying to solve, and get them to align with you. There are many ways in which you can engage people, and so don't get frustrated if you're a developer and you're trying to find a business person or vice versa. Just keep trying and find people that align with you and your idea. But don't compromise on choosing a co-founder. And I've seen this with some of my friends where they put together a team where the so-called co-founders, they didn't quite gel together. And so I'm very lucky to have an amazing co-founder. So find somebody that has complementary skills that you really get along. Work with them for 3-6 months, even before you get into anything formal with them, right? Running a startup's like a roller coaster, and things are going to get tough. You have ups and downs, and sometimes you need somebody who not only from a technical skills perspective complements you, but also from maybe an emotional perspective helps you and supports you. And so so spend time and effort thinking about who that right partner would be if you don't have one, and don't jump into it. Next slide, please. The other thing which is different today than back then is it doesn't take much to get started. You have an amazing infrastructure and support system these days including programs like 1Mby1M, where you can get a lot of help, support, guidance, whether it be strategic, whether it be operational. There's legal services, AWS, ADP, ELANs. I mean, you think of a need for you as a startup founder, you have somebody servicing that need. When we started, we started with less than, I think, $5,000 of our own personal investment. And we were streaming videos, which was very, very expensive back then. But, given how things have changed now, there's so much infrastructure in place, there's so much of support in place that if you are an aspiring entrepreneur and you have an idea or a problem that you're trying to fix, don't be afraid to make that leap. You have a lot of help. But having said that, you have to be cognizant of how you are executing. And again, here in the Valley, sometimes people tell you that revenue is not important, just grow users. And that may be fine in a few select cases. But for the most of us, raising capital, even if you're doing well, takes time and effort, and it's not guaranteed. And so what we found out was, for us, revenue was the only medicine to our problems. So don't lose track of that. When you're building a product, make sure you test it with your customers, make sure that if you're charging them for it, it's a price point that they're willing to pay, that they're actually paying for it, you're generating revenue, because if you're generating revenue, then it addresses a whole bunch of problems or issues that you might potentially face, and it can really take you far. But pick your battles, right? Do one thing and do one thing well. When we focused on cooking as kind of the first topic or area of interest for us, we picked cooking, but then we decided to focus on video, because that was something that nobody was doing. We were going to be different, and that's really what we wanted to do. When we moved into connected TV, we gave up on desktop and mobile. We said we're not even going to focus on it, at least for the short term, because we wanted to be the company that's number one in connected TV and distribution on those platforms, right? So when you're small, given the resource constraints that you may have, you have to really focus and narrow down what you're doing and not try to be everything to everyone. Next slide, please. Again, this is from a product perspective, so don't try to be better, be different. And again, we kind of learned that lesson as we were going through our journey, where I always take the example of this band Kiss. They're not the best band, but they're different, right? They have makeup. If you go to their concert, I mean, it's a concert like none other. They have makeup, they have pyrotechnics, they have fireworks. It's a crazy concert to attend in some ways. And so you have to be that. You have to be different. You have to get people to take notice, because if they take notice, then they're going to share your product. They're going to go tell people about it. And that kind of takes me into the next slide, which is, figure out your go-to-market before you launch your product. So especially in the consumer space, and especially with first-time entrepreneurs who might be engineers by background, I see that a lot, where and we kind of had this approach where we're like, yeah, let's just launch it, and then we figure out how to market and promote it. Your audience development strategy or user acquisition strategy really needs to be baked out before you even start writing the first line of code, because in most cases, your product needs to incorporate and support those marketing strategies and techniques that you have. Sometimes people think of marketing as viral marketing, and I feel there's no such thing as viral marketing. You really have to define your go-to-market before you build your product, because your product's an essential part of it. Next slide, please. I haven't raised money, so I can't really speak a lot about it. But again, just based on my experience and talking to friends, what I feel is, again, VCs, I think are waiting longer to invest in companies. They want to make sure that they invest in companies that are not just a slide on a PowerPoint, but also have actual products, have actual customers, and most importantly, I think have momentum. Right? They talk about investing in teams and investing in companies that have huge, market size and whatnot. But I think at the end of the day, to them, it's all about momentum. So if you want to raise money, you have to show momentum, and the way to show momentum is by actually having a product and customers and revenue. Next slide, please. So again, based on our experience, things will always go bad. It's a roller coaster, but you have to be prepared to adapt and pivot quickly. Don't, and sometimes I feel that where we probably waited for 6 to 9 months to figure out what we wanted to do, we could have potentially done it in maybe 3. So, so don't be scared of adversity. Just be ready to pivot and figure out what you have to do next. And most importantly, don't quit. Right? Just keep at it, because things change. You come up with new ideas. You come up with new strategies. And so, an essential part of being an entrepreneur is having that persistence and resilience, where even when things go wrong, you're able to kind of ride that wave and come out on the other side of it. So, and that like I said, was true for us. And had we raised venture capital, like I said, we would have been shut down maybe 3 times over, but we persisted. So just the last few slides, my idea of startup when we actually started working on our company was, it's sexy, it's glamour, I had just moved to the Bay Area. And so to me, I thought, that's really the world that startups live in. But, if you ask me today, it's a grind. It's a lot of work, without any guarantees of any sort of returns or recognition. But you do it because you have an idea or you have a problem that you're trying to solve, and you care so passionately and deeply about the problem that you're willing to go through all of that's involved. So, so for anybody who's trying to start a company, that'd be my that's the outlook that I have now. But the one thing that hasn't changed is it's a lot of fun, and so enjoy it, while you're going through that process. And I guess this is the last slide. So just 3 key takeaways, if you forget everything else that I've said, is first, you don't have to be a genius to start a company. I think we all face problems on a day-to-day basis. You have to identify a problem that you care really passionately about. You have a solution to fix that problem, go out and do it, because if you don't, somebody else will, right? The second thing is it's all about execution. So focus, focus, focus. Think about what you're trying to do. Think about how you can execute on it, and that's all that matters. You're going to have competition. There's nothing you can do about it. All you can control is how you execute, and that's really what's going to define the success for you at the end of the day. And then finally, if things go wrong, adapt, pivot, persist. Just don't give up.
So, folks, Vikrant has built a company with many millions of dollars of revenue and has always remained profitable. And there's one last thing I want you to hear from Vikrant, which is this company has been built. Future Today, which started life as iFood TV, was built with an advertising business model. However, Vikrant will tell you that he doesn't think that today those of you who are trying to use the advertising business model to start companies, he doesn't encourage you to do that. Vikrant, could you please comment on that conclusion that you've come to and just wrap it up with that one nugget?
Yeah, no, absolutely. And, I think the ecosystem's changed so much where the vast majority of advertising dollars are now controlled by, really 2 companies, Facebook and Google. And if you have to be an ad-supported company, one, the scale that you need to be profitable is humongous. I mean, like I said, tens of millions doesn't even cut it. You have to be in the hundreds of millions from a viewership standpoint. So the cost of acquiring all those users is so high that sometimes it just doesn't make sense. The second thing is, if you want to support an ad-supported, you want to operate on an ad-supported model, you have to have your own sales team, which is really expensive. And then you have to really compete heads-on with the likes of Google and Facebook, trying to convince agencies that they should spend their advertising dollars with you and not with, the likes of Google and Facebook. And so I feel that, the user base that you need to have, and then all the challenges that come along with running and operating your own direct sales team, I feel sometimes that it's just not worth it. I think there are other business models that can be explored, and I echo what Shramna was saying, that you really need to think twice before you embark on a company that's based on a business model that's completely ad-supported.
Great. Thank you, Vikrant. We're very proud of you and wish you all the best.
Thank you. It's been great. Thanks for all the help and support.
So we are going to move to Heidi Jannenga. And Heidi actually has a different business model. She's doing more a SaaS business model. And let's listen to Heidi's story. Heidi's company is one of our case studies. As you know, those of you following the program, we have a lot of case studies that we are teaching you the program through. So Heidi, welcome to the program, and take it away. Your audio is not coming through.
Sorry, I'll take myself off of mute. Thank you so much, and I really appreciate the opportunity to be here again and to share the WebPT story. Also echo a lot of what Vikrant had said about 1M1M and sort of the philosophy behind it, and I'll just add to, my kudos of your support of women entrepreneurs. More and more data is coming out that, women who are entrepreneurs or even in the C-suite of companies really add so much tremendous value, and the actual financial profitability of companies is actually that much higher. So we just need to keep pushing and get more and more women out there doing their thing. So I'm proud to be able to tell the WebPT story so you can move forward. My name is Heidi Jannenga. I am a doctor of physical therapy. I'm the co-founder and president of WebPT, which we're celebrating our 10-year anniversary this year. So it's hard to believe that it's only been 10 years. I feel like this startup phase and now into hyper growth and a couple rounds of funding later, we should count those years in dog years sometimes. But so we've been lucky enough to have quite a few accolades along the way, including being listed on the Inc. 500 list or 5,000 list for the last 5 years in a row, crossing our fingers for number 6 this year, which puts us in a very coveted category of only 7% of American companies who are able to achieve that status. So super excited and proud of what we've been able to accomplish. But it all started, next slide, with an idea. I'm actually a physical therapist, and if you move to the next slide, I'm a physical therapist, and I was working as a physical therapist and also a clinic director running 3 practices here in Phoenix, Arizona. I had P&L responsibilities, and one of our largest expenses was transcription and dictation. And so my idea was to try to find a solution that would cut those costs. And a lot of our referring physicians had started using electronic medical records, so we thought there had to be something out there for physical therapists too. And when we did our search, we found that there really wasn't. There was definitely nothing web-based, and if any of you have ever been to see a therapist, you know that we don't sit behind desks very often. And so having to be tethered to, an office or a desk space was just not feasible for a workflow of a therapist. And so I partnered up with a technology co-founder, and we decided to build something that originally was just supposed to be for my practices. And so we got it up and running, and we were getting very positive feedback from the therapists within my practice, and some of my colleagues in the area also started to sniff around and say, hey, what are you doing over there? I've heard it works really well. So it took us about 9 months to build version 1. With just my practice, and then within the next 6 months, we had 10 other practices up and running and using our platform, also giving us very positive feedback. And so we did a little market research at that time, and we found, and this was back in 2007, we found that 80% of the physical therapists in the United States were still documenting on pen and paper. So light bulbs go on, and we had, recognized that we had stumbled onto something. So we decided to launch the company in February of 2008. We were all bootstrapped at this point. This is actually our very first office, which was the back of a storeroom in the back of a coffee shop. So we had one employee. We launched the company in February of 2008. And we sold 5 clinics that very first month. And then every month after that has just been our next best month. So if you advance the slide, we've continued to grow. In 2010, we basically had bootstrapped up until this point, and every month we had to decide, based on our revenues for that month, what was the highest priority for the organization. Did we need a new technical support rep? Did we need a new server? Did we need, a new sort of opportunity or a marketing opportunity that we had to put money into? And so we had to make these decisions, basically living hand to mouth, putting all of the money that we were making back into the company. Now, we were profitable, but we were slow to grow. And what we recognized very quickly was the demand for our product. We couldn't keep up with the demand for our product. And so we decided in 2010 to take in a small round of funding. We did local pitches here in Arizona to angel groups, and we ended up doing a deal with a local group called Canal Partners, which was led by Jim Armstrong, who was the founder of JDA Software, which is now a multi-billion-dollar point-of-sale platform that he started in his garage 30 years ago in Canada. And so not only did they bring financial support to the organization, but we had this amazing entrepreneur who had, basically lived through what we were doing as somebody who is now an advisor and on our board. So key takeaway, if and when you decide to do funding, it's not really about just writing a check. It really has to be about getting resources and opening up doors for other opportunities that you might not even know exist through the experience of others. Another key takeaway was that we needed the money because we couldn't keep up with demand. And so what we were able to show through financials, not only were we bootstrapped for 3.5, 4 years prior to that, but we were already profitable. And so we had a model in which we knew customers wanted to buy our product, and we had a significant greenfield opportunity in front of us in which we were able to show that 80% of the market was still available to us. Next slide, please. So, we continued to grow. We turned that $1 million of investment. We actually had $1 million in revenue run rated at that point, and we took $1 million into the company because we were already profitable, and we had a very good trajectory and market opportunity. We gave a very small percentage of the company away at that point, which I think is another key point whenever you're looking for financial backing. We turned that $1 million into 17 in 2 years, and so we used that money very well, judiciously making right decisions with that money, and as you can imagine, our investors were very excited and happy with what we had accomplished. When you have the SaaS metrics that we had in terms of the percentage of inside sales converting, our marketing leads converting into inside sales, and the potential greenfield opportunity that still existed at that point, you get a lot of VC, venture capital, and private equity attention. And so we held everybody off for quite a few years. But in 2014, we decided that we wanted to swing for the fences. We, again, did not need money, but we were growing super fast and recognized that there were changes that were happening in compliance, there were changes that were happening in the market, that if we were going to really meet our vision of, dominating and getting full market share opportunity within and fully disrupting our industry, that we we would need to, again, do a second round of funding. And so in 2014, we went through a process with a banker and ended up doing a deal with a top-tier venture capital firm out of Silicon Valley called Battery Ventures. And that was about a year-long process, and it was not easy. We had assembled a very good management team at this time, in which we had a CEO that had raised capital previously, which was very key because we had to keep our eye on the ball. Because at any point in time during that process, if our numbers started to dip or if things just went south for any reason, that completely could change the process in terms of valuation of the company, or their trust and their ability to see the trajectory that you were on. Luckily, we continued to crush it, and we landed a deal which not only put money into the company, but also allowed us as founders to take some liquidity off the table, which really, again, we had now in 2014, we had been running for 6 years at that point. And again, I know that doesn't seem very long, but in startup years, it's a grind. And so the ability for us to relieve a little bit of the pressure and not be afraid to make risky decisions for the organization was really important. We remained second largest shareholders behind Battery still today, and so this potential second bite of the apple is something that I am gunning for. So you fast forward to where we are today in 2018. We now, in 10 years, we now own over a third of the market share within the rehab therapy space, which includes physical therapy, occupational therapy, and speech-language pathology within the U.S. We have the opportunity for international expansion, but really our growth has now been through M&A. So having this financial backing has helped us to grow tremendously. We just closed a major acquisition at the beginning of 2018. We now will close 2018 just over $80 million in revenue. We have 500 employees, where Phoenix remains our HQ, but we're in 8 other states where we have hubs that have amazing WebPTers around there. So the evolution of WebPT definitely continues. We're not done by any means, but it's definitely another stage of the company, which has just been fantastic. And you can't imagine the learning process that has happened for me, starting out 10, 12 years ago, running a 50-employee private practice physical therapy company to now running a 500 company, multi-hub, multi-million-dollar business has just been an amazing, amazing ride. So how do we do that? Part of it, next slide, is from the beginning really, and this will only become, I'm going to introduce you to a concept called conscious capitalism, which is nothing political, I promise you, but really it's talking, because capitalism in general is about companies that are for-profit companies, and the gist of this is really that profit can be used for good. It's not necessarily only about what you see in the headlines, but it really consists of 4 key components that from the very beginning we embraced. And so part of it was from the beginning, we had a very strong purpose to our business, and that was really around staying focused in the rehab therapy industry, because that was our core competency and niche. We had a lot of opportunities to move outward and increase our market size, but the $6 billion market of rehab therapy, seemed big enough to us at the time, and now niche plays are really where it's at. And so when you're able to kill it in a niche, and become the dominant player, have the largest market share, that's meaningful, very meaningful for opportunities in the future. And so driving this higher purpose of embracing and empowering therapists to achieve greatness, which is our mission, around a common set of core values, which I shared in our previous broadcast, and happy to share those again for anybody who's interested, which were established in the beginning, which I'm most proud of, because now even at 500 employees, those core values still are what we live and breathe by in the organization. The second one is really around making everyone a stakeholder, and that includes, this means that you are not just driving towards a board and making decisions based on what the board is going to think. This is really, everyone has decision-making power and input power into the organization, from the employees to a community that we're actually existing in. Third is really around conscious leadership, and this is really about servant leadership and bringing people on that are like-minded in terms of understanding the importance of culture in a company, understanding, the importance of having this collaborative atmosphere. We just hired a new CEO in October of 2016. Her name is Nancy Ham. She is a consummate leader who's been in healthcare IT for many years, and I just can't stress how important it is, as you're bringing in senior management within your organization, that you have people that truly fit your culture. And that speaks for any employee, but definitely at the leadership. She's been an amazing addition to the team and has just helped our trajectory significantly since coming on board. And then last is just to really build, and now it's really about, for us, is maintaining our culture. Culture is going to evolve over time. It's not exactly how it was back in 2008. It can't be. We moved from 2 employees to 500, and lots of senior management leaders now in the mix. But the core and the foundation of who we are is still there, and that's what I think is, again, been, as a founder, because those core values are pretty much born out of you in the beginning, have been sustainable and scalable through this growth path that we've had over the last 10 years. Next slide. And so, at the end of the day, I'm obviously a very large organization now. We hate the word corporate here. We still kind of stick to our startup roots. Innovation is critical for us. In our 10-year celebration, we're having a 10-year, all-year anniversary party, and one of the really cool things that I love that came out of our marketing and event group was innovation with the I and the O switched to a 10, because it's such a big part of who we are. And so that passion around rehab therapists is part of the foundation of our organization, but that has to be passed down through everyone in the organization. That same passion, that same drive towards a common vision, a North Star that you have in the organization, is critical, especially as you start to grow fast. And we've been able to do that. I mean, it's really remarkable when I go down and spend time with our tech support teams, and they are able to have conversations with our members, our customers, as if they were therapists and have the same passion as I do. And this is really this is why, as we talk about conscious leadership, it's really about embracing the we and not the me mentality. That this isn't, you aren't in a silo. We really talk about this as, from the beginning, we call our customers members because we wanted to build a community around what we were doing. So whether or not you're using our platform or not using our platform, you can still be a part of our community, because we, in our marketing efforts, have launched significant amount of educational opportunities in which we've established ourselves as thought leaders and a go-to resource, which, at the end of the day, when you are ready to buy an EMR, we want to be the first one that you think about. I alluded to this earlier in terms of committing to your community, and this is how we think about it in terms of our stakeholders within our business. So of course you have your customers, of course you have your board, and of course you have your employees. But how many of you think about vendors or the community in which you reside? We're in the Phoenix Warehouse District, which is initially was an area that was forgotten. It was a bunch of warehouses. We thought it was cool because it was we could do what we want with it. It was very creative, open space where we could have tech teams and creative folks feel like they had a creative space to come to. And so all of these things embody who we are as an organization, and we talk about it in terms of rising tides raise all boats. When you're empowering others, they're going to empower you. So partnering with other vendors or folks in your community that help promote you, to help word of mouth, PR, right? All of these things that get your brand, your organization, your company's name out there puts you in front of a lot more folks that potentially either could buy your product, or it also helps for us with recruiting. I know probably all over the world finding technologists is not easy right now, but when you have a brand, you have a culture that people talk about, and your reputation, that really stands out. And the more people that are talking about you, the better opportunity you have to bring the best top talent that you can into the organization, and that's what we've been able to do. And again, partly why we've had the success is all around the people, which is, I think, the next slide. And so when you find great people, it's important to empower them. You're hiring them for a reason. You know, for us, it's 50% your skill set and 50% your cultural fit. And the skill set is critically important. And as we've grown, it's really become more specialized in skill sets. When you're in a more startup mode, it was really around how many hats could you actually sustain and what was your change management tolerance, right? Because things were moving very fast and you had to one day be on the phones with customer support and the next day, you know, you might be learning HTML to help with a website. And so having those sort of people that are able to move through and feel comfortable in chaos, really important. We're now in a stage where it's very specialized and we need people that really have expertise in areas as well as entry level, but people that are able to pass on their expertise. And one of the things that we talk about from a leadership perspective is really empowering people and giving them autonomy in their roles. You hired them for a reason. Make sure that you have the expectations laid out clearly, but then let them run. And so finally, you know, as an entrepreneur who's been through a lot of phases in an organization in a very short period of time, you know, some of the things that I have learned over this last 10 years specifically is really about this is a grind. There's no way about it. You know, Vikrant said the same thing. Like, it is hard work to get to where we were. I know sometimes it seems easy, and 10 years goes by as in a flash. And when you look at it from the outset and you hear all the numbers, it's like, wow, how did you make that look so easy? It wasn't easy. There was tons of sacrifice, lots of hard work, lots of mistakes and failures along the way. So understand that people who have gotten to a place like we have really worked hard to get there. And be patient. You know, things don't happen overnight. We've had some, you know, stars align in terms of compliance things with the government which helped sort of put us in the right place at the right time. And there is luck involved in successful startups. There just is. There's things that have to happen, and timing is everything. And lastly, just get out of your own way. You know, I think especially for us, for me as a woman, and potentially other women entrepreneurs out there, you know, part of it in the beginning was me living this imposter syndrome of jumping from a 15-year career into software, which I really knew nothing about, and not believing in the skill set that I brought to the table was going to actually fit a completely different industry. But when I finally stepped out of that and was able to have some quick wins and understand that the skill set that you bring to the table was immediately fitting and needed in a growing business, I was able to get out of my own way and really help just push forward and get the company going. And so a lot of times the negative talk that we end up pushing too hard sometimes slows us down and creates barriers for ourselves. So sometimes you just gotta get that out of the way. Stop hearing that. Find mentors, find people that truly believe in you, and that will give you sound advice. Not people that just want to tell you what you want to hear. It's really important to be able to take constructive criticism as well.
Fantastic.
I believe that's the last slide, so thank you.
Very inspiring, Heidi, and your points are all really interesting and important points. Giving luck a chance to play means that you have to give runway to luck. If you quit, or if you think that luck is going to hit you within the next 3 months, that is not a runway. You're not giving luck enough runway to play. But if you give luck 10 years, 12 years to play, luck will probably find its way to your life and you will have a shot at it. So thank you. Great presentation and very inspiring points there.
Thank you so much. Appreciate it.
Folks, we are going to move to CliniOps. Abhik Pal is the CEO, and this is a company that is currently in the 1 million by 1 million program and navigating super well. Abhik, your turn to relate your lessons from the trenches.
Thank you, Shamana. And good morning, everybody. I'm Abhik Pal, founder of CliniOps. So I was actually part of the 1 million program when I was just starting about 3 years back or so. It helped me a lot in understand the nuts and bolts of entrepreneurship and how to navigate the very, very early stages. And then, of course, as many of the others said, Bootstrap First was a key mantra. And we did Bootstrap, and now after about 3 years, we're back in the program, looking for some support to navigate the next stage. So thanks a lot, and looking forward to share our story. Show on the next stage, please. Okay. So the CliniOps is a software company and a data science company. We're working on a digital transformation of the clinical trials. I'll talk more about what clinical trial is and how our solution helps solve what the problem and stuff. So here's just a quick snapshot. So we started in October 2013, so little over 4 years now, a lot younger compared to the other two companies we just heard. Anyway, we have an office here in Silicon Valley and one in Calcutta in India. We have a diverse set of folks, actually, engineers, data scientists, domain experts, statistical analysts, doctors. It's a small 15-member team between the two offices and a few consultants. And we're supporting studies in more than 15 countries now and have more than 50,000 patients on our platform. Main customers are pharma, biotech, and med device, but we also work with academia and foundations, anybody running clinical trials, right? So we've had supported actually works with Howard University, Stanford University, Gates Foundation, USAID, and many such organizations as well. In terms of the market size, about a little over less than 10 billion with a healthy double-digit CAGR. And also received several traction along the way, 5 hottest companies, eClinical Company of the Year, top innovations and stuff. But we've always bootstrapped till date and grown organically through customer funding. Lots of ups and downs, but definitely a great experience so far. So on the next slide. So here's the team that kind of helped us get here. I actually started as a computer technology background, and then graduated from IT, came from my MBA, worked with 2 startups. The first one was Euclid, got acquired by Persistent, and then I joined another boutique consulting firm called FocusFrame. Sold a product to SAP and then got acquired by Hexaware. I was all through in the enterprise application space, so not really in the clinical area. I was traveling like 45 weeks a year in about 40 plus countries in this whole span of time. And then gradually got involved with the entrepreneurship side of things, and joined hands with a friend of mine, kindergarten friend, who was starting a company called iCure in India. It was last mile healthcare, rural health. And it was a very nice experience and learned a lot on the way, and actually a lot of those actually helping me in my current area of focus. I still sit on the board of iCure. And then Subbu joined us as a co-founder, as the CTO. And I'll talk a bit about him in my next slide. Partha, also from IIT, joined later as the global delivery head. He was Cognizant Life Sciences from early days, still grew it to a much bigger, I think it's $1 billion entity for Cognizant now. Pat is a physician, joined us from the early days as well as an advisor, and she brings in a lot of the the patient-doctor interaction, those kind of workflows into the mix that all went into the design, product design. And Arjun is a co-founder of HCL, part of our team. So let's talk a little bit on the journey so far. From the next slide, please. So the first thing is, once you have an idea and you're ready to, get started, is to find a co-founder. I think some of the earlier speakers spoke on that as well. Building a company is not easy, right? And building it on your own is very difficult. So as an entrepreneur, you're always selling, right? You're selling your business idea to an investor, selling your products and services to your customers. You're selling to your employees. But the first thing you have to sell is sell your dream to an entrepreneur, to another person, right? Your co-founder, somebody you can trust and is with you through thick and thin, right? So that's something I think very important. And I was fortunate to have Subbu join us as the co-founder. And he's also from IT. We knew each other for a long time. He actually worked in this space as well. So that helped. He was with Sanofi first, and then Life Technologies, and that got later acquired by Thermo Fisher. So in the early days, we decided to kind of split the responsibilities, and he was focused on the product development, the product roadmap, the partnerships in this space, and I focused on all the other aspects, finance, marketing, sales, PR, and all that stuff. So that helped, having that demarcation in the roles and having somebody to own and drag it. Next one, please. The next thing in my mind is to kind of find your first pilot, right? I spoke to many relevant folks in the space early on to get feedback, understand the use cases, understand challenges, understand landscape, competition, all those things. This is part of your validation process, right? Well, what comes out of that is usually one of them becomes your first pilot. In our case, it was California Pacific Medical Center. I actually got introduced to this clinical trial industry through my wife. She's a physician from India, and she started her first job with CPMC and was running clinical trials. I had some domain knowledge in-house. And out of curiosity, I started doing some research on clinical trials, more so because I was also involved with IQ, right? That was in the healthcare space. So the more I learned about clinical trials, I realized that it's very global. And FDA prefers to keep it that way to get a heterogeneous mix or a diverse mix of patient population. So then I questioned myself, how do you collect data in such a global setting? And I've seen how data is collected, healthcare data is collected as part of the IQ experience. So what we learned is that the clinical trial process is very manual, very paper-based, very archaic, and hence a good technology solution can help in a big way. So to better understand, I actually registered or enrolled myself as a healthy patient in some of the trials that my wife was running. I went through the whole process. This is in downtown San Francisco, right? And to my surprise, they're still very paper-based and a lot of manual interventions and, paper signing, filing of these papers in cabinets and stuff. So I question that when you collect data, if this is the case in, let's say, in Silicon Valley, then how is it in the rest of the world, right? So, and this technology has evolved in leaps and bounds since then. So how can we better evolve or leverage this into the clinical trial space? And that was kind of the foundation. So I took the PIs out for lunch and dinner a few times and bounced a few ideas. They shared some more, and it kind of struck a chord. And then I started developing a prototype, which was eventually piloted at CPMC. So a lot of good lessons learned from that exercise, and all went into the product development. Over time, the product matured in a lot, advanced along the way to what it is today. Next one, please. So, so here's another thing that we did. Most of us are engineers, right? Or or many of us, and we get too involved in the product development. We iterate, we reiterate it multiple times. In the process, we burn a lot of time and money. And we realized that by the time the product is ready for the market, we probably haven't invested enough to get the market ready for the product or what we're doing, right? And then you tend to spend another maybe 6 months or a year to get to a point where you can kind of spread the word and get some early traction. And for us, again, product development comes a lot more easier than sales and marketing, and that's more reason to start early, right? So that's one of the things that we did, and it's also when you're doing that early marketing effort, it's not about talking about your product or solution, but to establish yourself as a thought leader, build some credibility, especially if you're kind of first-time entrepreneur or you don't have that pedigree. It's even more important, right? And fortunately for us, I was able to publish an editorial article on drug development news, which is widely read one. It triggered a lot of future downstream articles, a lot of publications that followed after that, and most importantly, some very relevant connections, right? So these interactions helped a lot in making further connections and build the people in the space and stuff, right? Many of them actually tend to be your early adopters as well. So following that DD News article, there were a lot of publications, as I said, were published, and a lot of media inks. And today we have almost, in the last 3 years or so, about 70 plus inks with almost zero marketing dollars. So I think getting that in your thinking as you build your company early on is very helpful. Okay. So after you have, there are two parallel tracks. One is the product in parallel, and one is the marketing efforts in parallel. So then the next step in the process is to get your first paid customer. So in our case, it took us about 2 years to launch the product, but the same year we launched, we got a top 10 innovation from PharmaVoice, which is another very widely read magazine in our industry. Excuse me. That gave us a good start, a lot of inbound leads as well. But having someone to open up your wallet is not easy, right? Especially for the first one. And so this, in our case, was National Kidney Foundation. And use case was not really very perfect fit for us, but the product was flexible enough to be configured to make it work. We received some good reviews along the way, learned a lot of good lessons, and in the process also picked up our first check. It was a very, very small amount, but what's more important is it gave us the confidence, it gave us the encouragement, and built something that customers are willing to pay. And now you actually have a story you can sell, right? And this eventually triggered a lot of other top brands as clients, both in academia and foundations, as I mentioned, Harvard, Stanford, Gates, and stuff. And in the next 2 years since then, we are supporting trials in more than 15 countries, pharma, biotech, and many others. So let me talk a little bit about what we do and how we do. So before we get there to the solution, is a quick snapshot of to understand the space, right? So when a pharma company brings a new drug to market, it takes about more than a decade, and you spend a lot of money in the process, $2 to $4 billion to bring that new drug to market over the period of 10, 12 years. A significant portion of that time and money goes into clinical trials, and that's the area that we're focusing on. A big part of that clinical trial time and money, again, is spent into something called SDV, Source Data Verification. And our technology or our solution eliminates this whole SDV in a big way or drastically reduces it. And we'll talk more about it. Patient engagement is another key. Patients drop midway into the trial, so it becomes a lot of burden and overhead for the pharma company. And no trial actually ends on time. That's and cost of delay is very high, depending on if it's a blockbuster drug versus a normal drug. And still the costs are very high, so we can't afford to have these delays. So what can you do by technology innovations and stuff to bring these drugs faster to market in a more compliant way, in a more cost-effective way is the key. So that's where we come in. Next question. So here's the how the tech stack looks. So in the earlier days, trials were usually done on paper. And then or Excel, and then eventually in the mid-90s, two companies came to the market and they developed something called EDC, electronic data collection. And till date, and this was in mid-90s, right? So almost 20 years later. So till date, all trials are done either web or a combination of web and paper. In 2013, FDA actually published something called eSource guidelines, and eSource is basically sourcing or entering or capturing that clinical trial data, the first entry of that data in an electronic way. Right? So till now, so the source documentation or sourcing is actually very important in this industry. So it's the first entry of the clinical trial data. If it happens on paper, then it's the paper source. If it happens electronically, then it's eSource. Right? And this source document needs to be saved for 10 years, 20 years based on the regulatory requirements. So it's important that you do it right. Otherwise, there's a lot of downstream cost overheads after the trial is over, is completed, right? So our first goal was to figure out a way to leverage some of the technologies that we have on our fingertips over the last 20 years since these earlier EDCs were developed. That's the social, mobile, analytics, and cloud, or SMAC as it is called. So mobile first was our key, right? So we wanted to get this whole data collection collected via mobile device. And some of the challenges that exist, especially in a global trial, is because internet is a challenge, right? Especially at the point of care. So most hospitals or health centers will have internet, but it's, let's say, a one-corner room or an IT room. But where the patient-doctor interaction happens, it's usually not there, right? So collecting data on a mobile device and collecting data offline. So that enables the patients and the doctors, the doctors and the nurses to be far more effective, right? With no dependency on network and other stuff. So that's another key. And finally, once you collect data digitally at the point of care, once you can eliminate paper, and once you can get closer and closer to real time, there's a whole lot of other things that the industry can benefit from, which currently does not exist. Leveraging machine learning, AI, blockchain, and others. There are regulations. There are things like adaptive clinical trial. But how can you adapt if the data is not real time? So most data right now is very stale. So let me just walk you through the process of how you get from the early data collection to file submission. The top one is the EDC, which I was mentioning earlier, electronic data collection. So you spend all this time, or the pharma companies spend all this time to millions of dollars to get a technology solution for EDC, but most sites are unable to implement it the right way. And it's not on the technical challenge as much as the operation challenges. For example, internet, as I said, doctors' familiarity with EMRs or computers. Nurses, they are not trained in EMRs or EDCs that much. So all of this put together, they prefer to collect data on paper first. After that, that becomes a source document. So it needs to be physically stored in, binders and folders and cupboards. It's a lot of, GCP compliant archival systems. A lot of money spent on that. And then these stay idle for quite some time. Usually from 6 to 12 weeks is the normal before the data is actually available online. And to get to that, there's a lot of manual transcription that happens. So, trained people will come and transcribe all the data into the EDC system. There's a lot of monitoring that happens because data cannot be, or part of the data, which is patient-related information, PHI, cannot be shared with the sponsors. And each of these paper documents has the footprint of PHI and clinical data. So it's typically, you just can't scan and send it because it has PHI. So monitors actually travel all these sites. A typical phase 3 trial, just to build some context, can have maybe 30 to 50 sites globally, right? And it can last for 2 to 3 years. It can have 2,000 to 5,000 or 7,000 patients as part of this whole process. So it becomes very difficult to manage on paper. And after all that is done, then FDA requires a third eye to make sure that the two data match, right? There's one set of data which is on paper for the site. There's this other set of data which is on digital or for the sponsors or the pharma. So they two need to match, and hence these monitors come into picture. And then finally, data management, where a lot of these, so along the process, because there were so manual interventions, a lot of queries or a lot of errors happen in the data. So that's fixed as part of the data management process. Again, a very consuming in a long-term process. Eventually, the database is locked and the data is ready for analytics. Right? So how we have done it differently is that we have built a very simple user interface on tablet, works completely offline, which is only for data collection. So meant to be used by nurses or frontline users in emerging world countries around the world. Very, very simple, has only two things: who is coming and what am I collecting. Who is coming is basically the patient info, and what am I collecting is basically, it's called case report form. So it is structured as to, blood pressure, from that heartbeat. So those are the two things. And it also has a lot of checks and balances that run behind the scenes, right, to make this data very efficient, very error-free. So if you enter some data which is outside some range, it will pop up right there, right? And you're only able to do that because you're collecting data digitally. If you were to collect on paper, it's just not possible, right? So those are the benefits. And then if you do that, you don't need any physical storage, very minimal idle time. Earlier I was saying 6 to 12 weeks. here we are doing 6 to 12 hours or even less. Basically, you collect the data throughout the day, and by the end of the day, you sync the data and go back home. So almost real time, the pharma company on the other side of the globe is getting this data, access to this data. And since you're collecting digitally, you can actually mask out the PHI versus the clinical data. So the protected data is not synchronized behind the firewall. So for monitoring, you don't need to travel. Sitting here, you can have real-time access of the clinical data as well. So monitoring effort reduces drastically as well. Same with data management, because a lot of the data management has actually happened upfront and upstream. So all that put together brings a lot of savings in time and money for this whole process, and significantly increases the data quality. So that's kind of where we add value and how we do differently from the traditional softwares out there. Now, in terms of adoption, so the early adopters in our case was studies where there's a significant Africa component, right? These solutions, the EDC solutions, which are currently out there in the market, the value proposition for us is far more easy to demonstrate if there is a site which is not very advanced, and offline is a big win for them, right? So we started doing some of these studies where, in Lesotho and Swaziland and Ethiopia, Somaliland, Nigeria, Tanzania, Equatorial Guinea, a whole bunch of these places, and these are all done by top brands running the trials. It gave us a lot of credibility and a lot of learning, and the product also evolved a lot along the way. And obviously, if that works in Africa and Asia and other places, the same will obviously work in US. And in fact, a lot better. So instead of 6 to 12 hours delay in syncing, most of the places here may have real-time syncing or much smaller time lag before the data gets ready for analytics. So these are some of the benefits. And as I said before, we have more than 50,000 patients on our system, several different countries, and fully compliant. We are supporting disease areas across many different therapeutic areas. But one of the early ones, as I said, was the neglected tropical disease and infectious disease, things that happen in emerging world countries. They gave us the boost to get started. So we have a few case studies, but I think in the interest of time, maybe I can focus on just one of them. This was a big study run by the Gates Foundation with drugs from and GSK. It's a triple drug program. It was a 24,000 patient study, and when we received the protocol, it was a 38,000 patient study. So typically, you do these analysis ahead of time that will tell you how many patients you need to enroll to get to a significant number. In this case, it was reaching to 10,000 patients with a certain criteria. And usually, what happens is you run all this trial, and at the end of the first year, you freeze it, and then you do the analysis, hoping that you hit the 10,000 mark. But since in our case the data was real time, they didn't have to wait till the end of the year. They were seeing it almost near real time. So there was one curve showing the enrollment. There was another curve showing how close are you to that 10,000 mark. And it so happened that 24,000 patients somewhere in Papua New Guinea actually got enrolled, and everybody was ecstatic the very next morning because the study was about to be closed because they have hit their mark. And in the process, they saved themselves in spending additional time and money to enroll another 14,000, right, for the 38,000. And that was only possible because of the nature of the solution, because how we had designed it, and that real-time access to get to that analytics and stop the study at the right time. To add to that, typically for studies like this, you usually get about 50 to 100 queries in not so good sites, especially the ones that we were dealing with, is Papua New Guinea. There's some remote island in Indonesia, a remote village in India, Fiji, Haiti. So all these are somewhat island countries where these mosquitoes actually happen, and these are not very tech friendly, or the infrastructure is not that robust. But even then, we were able to manage collecting all this data completely digital, almost no paper. And from 50 to 100 queries per patient, the data quality was so high that it brought it down to just 2 queries per 100 patients. So it's a drastic increase in data quality as well. Published WHO actually published reports based on this data. We got a lot of traction out of that, and a lot of downstream projects followed from there. So all these actually helped us, create exciting stories that you can further sell into other customers, learning from there. So, so with that, I don't want to take too much of time. We received several tractions along the way. The first one is very recently, we were marked among the top 4, including the 2 market leaders in their Vision 2020 for e-clinical solutions. We've continued to grow all through customers and revenue, and that's the key. And we'd like to keep it that way for some time. With that, thank you very much. If you have any questions, happy to answer.
So once again, very proud of what Abhik has achieved. The company has crossed 1 million in revenue in 2017 and is on its way to a massive growth this year. The first quarter has been fabulous. It looks like a superb year. So textbook case study of the 1 million by 1 million methodology. All these stories that you're hearing, there's a reason why we have chosen these stories to showcase for this 400th roundtable, and I've invited all these entrepreneurs who are literally following the 1 million by 1 million methodology, and vice versa. The 1 million by 1 million methodology is built on top of the journeys of entrepreneurs who have followed these kinds of methodologies. So it's a great validation of a methodology, a proven methodology that all of you who are listening can follow and become successful. So thank you, Abhik. Very proud of you and your accomplishments, and also very proud of our next presenter, Abhishek Rungta. And I want to make one point before I hand it over to Abhishek for his presentation. Both Abhik and Abhishek have roots and connections into where I come from, which is Calcutta, India. Abhik has an Indian operation in Calcutta, and Abhishek's primary operation is in Calcutta, India. So I wanted to acknowledge that and express my pride and joy in seeing that entrepreneurs out of Calcutta are also doing great things. So Abhishek, over to you. We can't hear you, Abhishek. Your line is on mute. So folks, while Abhishek is setting up his infrastructure, I want to emphasize again and again the basic philosophy of Bootstrap First, raise money later. For example, right now, all the companies in our portfolio that are bootstrapping and getting to a certain level of traction are able to get attention from investors, no problem. Don't forget that basic mantra. Abhishek, are you all set? So folks, as you are listening to these case studies, also keep in mind that you can learn the full methodology at your own time, at your own schedule, and even if you have a job, let's say you have a job, you are doing this on the side, you're starting your first company on the side, just tiptoeing into entrepreneurial waters, that's fine. You can learn the methodology just by using the 1 million by 1 million basic program, which is our curriculum only, and you will be, ready and raring to go using those building blocks. The first time entrepreneur journey is incredibly steep and tough. You just have to learn a whole lot of stuff very rapidly to be effective and to be able to make progress. And in that journey, having a proven methodology to work with is enormously valuable. So that's, that's one of the repeatable, highly repeatable things that you can do in, advancing your journey in putting one foot before the other. Each one of the presenters that you've heard from have had to climb that steep learning curve of the first-time entrepreneur. Each one of them are first-time entrepreneurs, and as you can see, they have been successful. They have been able to learn what needs to be learned. So as Vikrant said earlier on, it is not rocket science. You don't have to be a genius to be a successful entrepreneur. You can learn what you need to learn as long as you have the right attitude. You need patience, you need the willingness to learn, and you need all the pieces in place, that methodology piece in place, so that you can put one foot before the other and make the right decisions. Let's check with Abhishek again. Are you on, Abhishek? So Abhishek, you need to dial into the phone line, otherwise we will not be able to hear you. You will be able to hear us, but we will not be able to hear you. Have you dialed into the phone line? The other thing that you've seen today in the different case studies that you have listened to, you've listened to a media entrepreneur, somebody who is using the advertising business model, who is telling you not to use the advertising business model. And then you've listened to two entrepreneurs who are both operating in the healthcare IT field, both in two different areas of healthcare IT, and that's been very interesting exposure to two different, completely different areas. Heidi is using a SaaS business model and selling to small customers. So Heidi's customers are small physiotherapists. And then Abhishek, I think you're on the line. You need to mute your computer so that it doesn't stream echo.
Yes, I think I have muted it. Can you hear me now?
We can hear you, but you need to mute your computer so that you don't stream echo.
Sorry.
What's going on, Abhishek? Why can't you mute the computer?
Why can't you mute the computer?
Maureen, please mute Abhishek. The whole experience for the rest of the people are getting disrupted this way. So we have actually one more presentation for you. Samta is also a 1 million by 1 million entrepreneur, and the company is, just as I was telling you, you're exposed to different spaces. Abhishek started life as a services company. I'm going to start, telling you the story just so we don't get the whole call disrupted because of Abhishek's technical issues. So this company started as a services company, and bootstrapping using services is a core methodology that we use in the program, and it's something that works magically. Abhik Pal has also used bootstrapping with services as his methodology to get to the kind of validation and so forth that we got to. Abhishek, are you okay now with your call?
I think so.
All right, go ahead. Go ahead with your presentation.
Yeah, so I think I'm on the first slide now. So thank you so much for this opportunity, Shamana, and I'm glad that I'm here. And thanks for all your help all over. And so yeah, I think Shamana touched the right point. I started this company, Investment Technologies, because I didn't know what else to start. And actually, there was when I started off, there was no positioning, there was no planning, there was no exposure about how do you exactly figure out what to do. And therefore, web design and development was a very obvious thing that I saw in front of me as we got started on it. So the company started off obviously out of passion for internet, but of course it did not have a very concrete plan or any kind of a positioning or marketing which Shamana so strongly advocates. So I will just take you through a scenario. I'm not going to talk about the starting years of investment. I'll talk about a major transition that we made in the year 2012, and that's what we call investment version 2.0. So the company got started in 1997, 5 years as a hobby, and then almost like 8 to 9 years, and then we faced a big challenge in around 2012. So what we figured out around 2012 was the company was having absolutely flat growth. It was having so first of all, what was the positioning at that time? It was just a white label outsourcing partner for digital agencies and small businesses. It used to be web design, web development, mobile application, SEO and SEM. You will find 100,000 companies like this in the market today, and you can go and deal with any of them. There is no strong reason why you would choose one over another. Possibly the biggest reason would be that one side is beautiful and the other side doesn't look great enough. So honestly speaking, there is not much positioning out there. And this led to a situation which was about extremely flat growth. There was high bad debt because there were lots of clients who did not have any credit history. We were working for them. Suddenly, we see the clients have vanished off the scene. We won't be able to get in touch with them. Our sales was unpredictable. It was hovering around $3 million, but it was unpredictable. It means we were not sure if the same sales, which was around $250,000 a month, would be repeated the next month or the month after or the month even after that. So the sales was to a great extent depends upon the seasonality and client's business, and it was totally driven by the small agencies globally. Third was that it was well dependent.
So Abhishek, let me make one point here based on what you're saying. You know, there are numerous outsourced software companies out there, software services companies out there, and it's very difficult to differentiate. It's very difficult to get attention from customers and so forth. So this is the case study that Abhishek is presenting to you here of moving from a not terribly differentiated, relatively run-of-the-mill software services, outsourced software development company to something that is more differentiated and more unique and more scalable is a case study that lots of entrepreneurs would find relevant, and it would resonate with lots of entrepreneurs here. I mean, I know there are people in the room right now as we speak who have had that situation or who are currently in that situation. So, Abhishek, talk about how you managed to pivot out of that rut.
Yeah. So let me just set the exact situation that I was facing in 2012. Couple of more points. Because of all the situation, the team was extremely demotivated. I had 400 people. My margins were getting slimmer and slimmer by the day because every year the salary cost was going up, but clients would pay even less and less because there was massive competition. I can actually say web design and development is the perfectly competitive marketplace if you are a student of economics. And last but not the least, I was continuously exposed to fraud and poaching. Just between 2008 and 2012, I saw at least 10 to 12 incidents within my company where a bunch of guys will come out, they will take away 5–10% of my clients, 5–10% of my team, start a new company. Great for entrepreneurship as a whole, maybe, but very bad for a business which is being run there. And yes, last but not the least, the lack of management depth because I was the only top management guy in the company. So this was a scenario, which means that we have achieved things, but we are struggling not to grow, and if you are not growing, you are dying. So what we did next was something very interesting, and that's what I want to cover. So, and I think this is a traditional problem that every business which is growing faces at one point of time or other, then they become a commodity. And at that point of time, they need to really think through that where do they want to go and how they want to be perceived. Because if they are just perceived as a commodity, it's the beginning of the decline and possibly death of the business. And that is what we understood. And I think we understood at the right time, and that's why we survived. So what we did was, the first thing that we did was that though we were doing digital services in a way for other companies, we were not doing it for ourselves. We understood that we ourselves need to digitize our processes, digitize our data, make sure that everything is plugged. So, for example, if a particular client is making a payment and that payment is not getting streamlined to the company, and that whole project is not tracked, end to end, which means starting from a lead to a complete closure of the project and the request for the next project. If everything is not digitized and put into a workflow within the organization, there is a high probability that a leakage will happen and the client will actually be taken away from you, especially if it's a small client and you don't have a very special reason why a client should work for you. So one thing that was a big realization was that if you are stuck in a business that can be done by a 50-people company or that can be done by a startup and you have become large, then you are absolutely in an extremely dangerous position. So that gave us a realization that there has to be entry barrier for whatever we are doing. If any and every company can do exactly what we are doing, then there is no entry barrier in what we are doing. And that is, again, a very dangerous situation. And obviously what we realized, another thing is that there has to be an exit barrier for your client. So a client should stay put with you until unless, you have really made his life hell. So you have to make sure that these two things happen, entry barrier for your competition and exit barrier for your client. And that is what we started doing. The first thing was basically plug the gaps using, plug the gaps in the system. Sorry. Second was, we put in the accounts and MIS departments in place. We made accounts the center stage of the company because accounts actually control and can give us a pulse of the entire organization. If we don't put all the data points into the account system, what will actually happen is that everyone controls the system. There is no central sense of direction to the organization. There is no central repository of data. There is no central repository of clients. So what we created was a central repository which controls everything, and the MIS department which could do reporting on top of it, and each reporting signifying where we stand, what's going wrong, what's going right, what can be fixed, why it should be fixed, and how it can be fixed. So unless these two things are put up, and you don't need to really be a rocket scientist to do it. I started with a simple Excel sheet where all the invoices were logged in, and I used to start making out reports from the invoices, and then track these projects for which the invoices were created. Because if a project is there and the invoice has been created for that, and X number of hours has to be allocated to do a project, I can simply tag it and check out that if those number of hours has been given or someone is actually doing something else. Which means that anyone in the company cannot work on a project which is not on the sheet, and so on and so forth. And then they started putting in the timesheets, and we again have more and more control over what is being entered. Eventually today, where we stand, we can actually calculate profitability of each and every project. We can calculate profitability of each and every individual, and we can calculate profitability of each and every client. Which means that if any of these three elements are going wrong, and it's consistently wrong, we can just change that or we can fix that. And that has been very, very essential for us where our margins have improved, and we have been able to prove the capability of this in 2 acquisitions. So we made 2 major acquisitions in the last 2 years. I will not say actually major because these were small ones, but we were trying out our systems on them. And when we tried our system on them, we were able to turn around both the companies from a loss-making entity to a profit-making entity within 6 months' time. So this is what was the power of the system that we built. Third was that we had to plug the leaking buckets to customer success management because customers were coming in and they were not being looked after and they were going out. So they were just trying us for 1 project or 2 projects and it was not really lasting long. So we were actually fitting into the company where only customers were in the credit and they were not happy at one point of time, and within 3, 4, 6 projects they would leave the company. So we created a complete layer of customer success managers who were actually customer representatives within the company. And what they did was basically make sure that the customer had a totally different level of experience with us. Last, moving towards the more important area that we did was, at the one point of time in 2012, we had around 500 concurrent clients which were served by around 400 people. This means each individual was actually serving more than one person if we can fraction out people is 1.25 people, the 1.25 clients were served by each individual, right? And you have to understand there is obviously a management team which is around 60 people. So in fact, one developer or one designer was helping and working with almost 2 clients. And this is not an ideal situation to have. Because,
Abhishek, I'm going to have to interrupt you a little bit because we're getting complaints in the public chat about the sound quality. So let me help you, shepherd the presentation at this point. I think the main thing to learn from this story is how Abhishek moved the company from being a commodity vendor full of operational risks and operational problems, bad debt, and so on and so forth, and get to a company that had actual IP and based on which he created differentiation and steered the company to be a much higher value, higher defensibility company. So Abhishek, let me ask you to highlight what was your choice in terms of positioning. So this is your next slide. What did you decide to do in terms of specialized IP creation?
Sure. So what we did were two important things were done. Number one is that we realized that there are either very large companies in the ecosystem which people can hire, but they are very expensive, and more problematic than expensive is those companies were not agile enough, and they were themselves struggling on the digital side. And on the other side, they had very, very small companies whom they cannot trust for a long-term association. So we positioned ourselves in that sweet spot that you are working with a company which is not going out of business anytime soon, has been around for 15 years, can do your work in agile fashion, and we understand digital in and out. And what we started doing was ensuring that all the capabilities we had, we put them in together under one single umbrella so that the client does not have to go to 5 different vendors to get a project done. Because digital is a subject which needs multiple capabilities under one place or under one roof.
But your real positioning,
a lot of companies are missing.
The real positioning win that you was to find a concentration in banking and insurance.
Of course, yeah. So I'm just coming to that. And the next big change that we did was we understood that we have to be domain expert. We just cannot be the development company, even if we are positioning ourselves in the sweet spot of a mid-tier company. So what we did was we started pushing ourselves into banking and insurance. We started doing insurance work, started building the capabilities, started to offer our services on a different pricing model altogether where we would share revenue instead of just a fixed fee. And that started working out. We got 1 insurance client, second one, third one. Today we have got 11 insurance companies with us. Today we have got 4 banks with us. And with all these banks and insurance companies with us, we have a steady stream of revenue and a short stream of revenue. We have got 3-year contracts to 5-year contracts from all these major clients. And guys are happy because we can compete for talent from the best of the breed of the companies, and we can then give them a run for their money in terms of competing for new contracts.
And you know what I find really interesting in this story is how for a long time, Abhishek's company had lots of clients and lots of small clients. And there were risks with those clients, there were payment risks, collections risks, all kinds of things. And then this positioning shift that you made into banking and insurance and this concentrated going after larger companies and so forth gave you an opportunity to do a bunch of different things. One is concentrate the client base into a set of high value clients who were reliable, and then you started developing intellectual property in the banking and insurance space, in insurance technology in particular, that you were able to reuse and get leverage out of. So what you see here is the movement of a company from a undifferentiated services company to a more differentiated company with core competency in a specific area with intellectual property and so forth. And that transformation, it's not an easy transformation, it's a difficult transformation, but you have successfully made this transformation. And there is something to learn because, you know, I am always amazed at how many software services companies are out there. So many entrepreneurs start off life just by doing projects for other people and in a relatively commodity way without any core positioning. And in a way, you started there as well, but you learned, you kind of maneuvered your way, and you have found a sweet spot where intellectual property is part of your differentiation. And that is something I wanted to highlight in today's showcase presentation of our 400th Roundtable. So congratulations on achieving that, Abhishek, and I know you run a very large workforce company, so there's a lot of people who are dependent on your leadership and your strategic maneuvering for their livelihood. And that's, again, another thing that is very important that entrepreneurs do is you and we are all responsible for other people's livelihoods. And this is another reason why I started 1 Million by 1 Million and wanted to support entrepreneurs who are going to be the pillars of the economic pyramid, right? And we have created a society where fortune is accumulating at the tip of the pyramid. So it's really important to support the entrepreneurs who are in the middle of the pyramid, who are not running billion-dollar companies, who are running these million, 2 million, 5 million, 10 million, $50 million companies that really constitute the solid economic middle of the pyramid. And the case study that we are talking about right now, Abhishek's case study, is a classic textbook example of one where a company that was perhaps a bit more fragile in the early days has become a lot more robust and a lot more differentiated through this journey. Don't you agree, Abhishek? That's
yes, absolutely, Samana. So yes, so it has been a learning, and I think what we did majorly was apply the learning and also get a lot of focus, because I remember my call with you, I think almost 5 years back, and when you said that, Abhishek, I don't see any very serious positioning here, and I think you were right, and eventually we learned it the hard way. We positioned ourselves after we figured out that we have to differentiate ourselves, we have to get in the right position to be identified, and we have to focus. We cannot just do everything. And but to fulfill my desire to do everything, the thing I started doing was to start acquiring small companies and then mentor those entrepreneurs to create what I call a network of capabilities instead of just a capability that the company has.
Excellent. So that's actually a great segue into the last segment of this call. Is I'm going to quickly explain to you how to use 1 million by 1 million. You can use it yourselves. You can bring your friends and family into the program. We are here. We are available. We are the most accessible set of people you would find anywhere in the world if you're looking for help for your IT and IT-enabled services business. You can go to 1Mby1M.com as the beginning of your exploration in terms of our resources. There's a terrific blog. Every single case study that we have in the program is actually freely accessible on the blog. You can also start reading the Entrepreneur Journeys book series. There are 12 volumes of those. You can come to these roundtables, and you can also join the full acceleration program, which is 1M by 1M Premium, which is what all these entrepreneurs you've met today have come through. You can start your, take your business, take your idea or your project, and ask yourself these questions. This is the 1M by 1M self-assessment. It's freely available on the website. These are the questions investors would ask you. I want you to ask these questions of yourselves. And if you get stuck, start using 1M by 1M Basic and learn the methodology yourselves. You don't, if you don't want to get into the 1M by 1M Premium program right away, you can start with Basic and just start doing curriculum and plugging your methodology gaps. There's a lot of learning to do. Other than that, just dig around on the website and learn about the program. I really wanted you to hear from all these entrepreneurs who are using this methodology on how it works, why it works, and how it has worked for them as part of this 400th Roundtable celebratory event. Case studies are the cornerstone of our program. The entire program is case study based. We want you to learn from other people. We want you to learn from Abhishek Rumka. Can you cut the audio, please? Abhishek? Thank you. I want you to learn from Abhishek on what kinds of problems he was facing. You know, being in an undifferentiated position with defaulting clients and so forth, that's a very uncomfortable position. But this is an entrepreneur who has been able to maneuver himself out of that corner and create a much more robust market position for himself. Every single entrepreneur I've heard today have maneuvered. Vikrant has had to pivot out of Google's algorithm change. It was a scary situation. He was in the program at the time when this happened, so I know what he went through. And you will find here empathy, because we are all entrepreneurs. Your peer group is entrepreneurs. The case studies are all entrepreneurs who have done it before, and that empathy is going to carry you miles and miles in leaps. So again, the methodology is lean, capital efficient, bootstrap startups. Financing philosophy is bootstrap first, raise money later. Do not go to VCs as beggars, go as kings. That is all. So as far as our programming is concerned, that is all. The next few roundtables are basically all in June. I am going to take a break in May and go travel for a bit. We do have one more session left, which is our rendezvous tomorrow in Menlo Park at Cafe Boroni. And then after that, the follow-on rendezvous are all in June. After I come back, Maureen, I think you missed the rendezvous tomorrow. If you could put that information in the public chat, that would be great. And even though we are a bit over time, it is a special occasion, so I would like to take some questions from you. If you'd like to call in and ask questions, that is fine, and you can also use the public chat to ask questions. So go ahead and ask your questions, and I'll be very happy to answer them. While you're doing that, let me introduce you to Irina Patterson. She will answer any questions that you might have about the program. Please feel free to contact her after this session. And the testimonial on your screen is from Girish Mathur, founder and CEO of Freshdesk, which is the largest company that has come out of the 1M1M program. They've raised $149 million of funding, but they bootstrapped first and raised money later. They got to paying customers, fully validated product market fit, and then everything else happened after that. Then we helped them win a $40,000 Microsoft BizSpark Startup Challenge Scholarship, and that allowed them to go straight to a Series A financing of $1 million without having to do any other seed round. So again, it's been a very, very successful company since then, has over 100,000 customers. Dharam Singh is asking, is there a case study on Abhishek in the program? So the latter part of Abhishek's journey has not been documented in a case study. There is a case study on Abhishek, but he hadn't yet done the full pivot to insurance technology. So if you do a search on Indus.net, there is actually quite a bit about the early stage of his journey. You will find a case study, but that last piece of the engineering that was done later is not included in that case study, Dharam. I was thinking about you actually when I invited Abhishek to share his story. The point is you can maneuver and pivot out of a commodity software services story to something more differentiated. But I know the case study inside out, so I can guide you on issues from there. So Benjamin Kaplan is asking, our Bootstrap needs to focus on sales and pushing product, how to manage my time between a program such as 1M1M and selling. Well, 1M1M teaches you how to sell effectively. We have extensive curriculum on how to sell effectively. Harashika is doing a vendor booth in one of the partner studios for $150. What should be your expectation to get in return for that value? I have no idea. It's hard to answer this question in vacuum. I don't have enough information about who's coming to these booths. You know, I really cannot answer this question in vacuum. So since you're a premium member, I suggest that you should come and talk to me in a private roundtable. But in general, anytime you spend money on anything, you should try to get good returns. If you've spent $150, try to get $1,500 in returns in sign-ups. Any other questions, folks? Very quickly. Durga Kalavagunta's first event listening to us. You're a small startup in Los Altos, California. You would like to find out how you could engage. So you need to sign up, go to the website and understand the program and just sign up. That's the only way to engage with me, actually. And since you're local, you may want to come to the rendezvous tomorrow in Menlo Park. So Maureen has put the link up if you just scroll up a little bit. Tomorrow's rendezvous is at Cafe Boroni in Menlo Park from 5 to 6 p.m. You can register, and the link is provided in the public chat. So I strongly recommend you come to that event tomorrow from 5 to 6, and we can chat more. But in general, you can just sign up right now. Right after this call, you can go and sign up on the website if you want to join. Anybody else?
Hi, Sherman, I have a question.
Yes, Serena, go ahead.
When is the best time to join the program?
Well, our philosophy is join the program as early as possible so that you don't make a lot of perfectly avoidable mistakes. And we know this methodology works. As you can see, entrepreneur after entrepreneur is using this methodology and succeeding using this methodology. So I would prefer that you join as early in your cycle as possible and start implementing the methodology. And then we have control over how to help you succeed. If you come, one story we hear a lot is, I've been working on my product for 6 years and now I need your help in raising money to market the product. And my answer to that is usually go get a job because you're about to go out of business. You've basically exhausted all your runway and I really cannot help you at this point. So I would prefer that you come to us early and not after you've exhausted your runway. Okay, folks, we are 2 hours into the program almost, and I would like to wrap up and give all of us an opportunity to actually go build stuff and make progress. I do have quite a bit of stuff going on today. I have to drive to Berkeley right after we hang up to speak at an event. But it's been a real pleasure having all of you here today and having all of you here over the years in the program. So Abhishek, Abhik, Vikrant, I'm really, really proud of you, what you have done, what you've accomplished. Heidi, we admire what you've done and we are delighted to teach your case study in the program. We have over 800 successful entrepreneurs case studies, and that includes 50+ unicorn entrepreneurs, 400+ venture-funded companies, 350+ bootstrapped entrepreneurs. So we have a tremendous, infrastructure here such that you, the entrepreneurs who are working right now, can stand on the shoulders of people who have accomplished huge things. And we are very, very satisfied at this point in the way this is working. The program is working, the methodology is working, and you can succeed if you follow the methodology. That is my parting message to you, and I'm sure we will continue on bringing you, hundreds of more roundtables and mentoring sessions. By the way, these are just 400 public roundtables. We have had that many and more private roundtables, which is our members-only sessions as well. So you can imagine how much online mentoring we are doing at such scale today. So we will continue, we will achieve many more milestones together, and along the way, many more of you entrepreneurs are going to be successful through the 1 Million by 1 Million program, and we are here for you. We look forward to working with you. Thank you for coming today and helping us celebrate this milestone 400th Roundtable event. Bye-bye.